Now it's time to look at the forceps. The first forceps is this. Now it's a small forceps. You can see here, right? Now this is basically to hold it. There is tooth on the tip of it. You can see the tooth. The tooth is right here. This is to hold it. This is what we call it as the Adsen's forceps. This is for holding smaller tissues, more precise location, and especially onto the surface. If you're going into a deeper one, you need a bigger forceps. And what is that bigger forceps? Let's look at the bigger forceps. Now this forceps also looks like Adsen's, but this is longer. And again, it has same tooth. The Adsen's also has tooth. This also has tooth, but this is longer. Now this longer looking Adsen's is what we call it as the Gillies tissue holding forceps. So this is the Gillies tissue holding forceps, and this is your Adsen's. What is the difference? Adsen's is small, Gillies is longer. So common sense, for using the surface surgeries that is on the skin or the subcutaneous plane, I will use Adsen's. If I'm using in a deeper cavity, imagine I'm working in the abdomen, I want to hold the tissue deeper, I will be using your Gillies forceps. Now, both of them, they have tooth, and when you hold the tissue, they are going to prick, punch and puncture the tissue, and especially if you're doing with the vessel, I don't want that to happen. So whenever you're working with the vessel, you need a special forceps. And that special forceps is this, an atraumatic DeBakey's forceps. You can see there is no tooth, it just snaps very well, holds it very well, and it is smooth throughout. This is what we call it as the DeBakey's atraumatic forceps.